Hello, I'm Dr. Sandeep Mittal from Medanta Hospital, working in the Department of Respiratory and Sleep Medicine. So we know that this new coronavirus has hit us hard, and everybody is panicked about it. India has just closed it down, and there's lockdown everywhere. Government has imposed curfew-like situation all over the India. So let us talk about it, what it is. So SARS coronavirus is a virus that belongs to family of Coronaviridae. It's a beta coronavirus, RNA virus. There has been coronaviruses since 1960s. Four of them occurs every year and cause common cold and cough commonly to patients without any serious disease. In 2002, there was a new coronavirus called SARS coronavirus 1 that caused outbreak in China, originated in China, and it caused epidemic in China. In 2012, again we had another type of coronavirus that was called MERS coronavirus, Middle East Respiratory Syndrome virus, that was also coronavirus. And that originated in Saudi Arabia and caused a limited disease in Middle East only. This time a new kind of coronavirus emerged in city of Wuhan in China. That is as far as we know about it. It originated in some sort of wet market there, and from China it spread to all over the world. So China has been worst hit country, and recently Italy has taken past China. So Italy has Europe as a whole has become center of this epidemic or pandemic. So WHO has declared it as a pandemic that involves whole of the world, and right now India is going through that phase where if we do not lock down or do not make social distancing, it can spread really fast. We already witnessed more than 550 cases in India, and they are increasing rapidly. So how does it spread? ये फैलता कैसे है? यूजली इसको फैलने के लिए जब कोई आदमी खांसी या छींकता है तो उसमें जो ड्रॉपलेट्स निकलते हैं, ड्रॉपलेट्स दैट कम आउट वाइल स्नीजिंग एंड कफिंग, if you are in direct contact with that patient, it can land on your mouth and nose, and that in that way it can enter your human body. Second mechanism that is proposed is fomite-borne. What is fomite-borne? Is like when you touch surfaces that are infected with virus, you can get that viruses in your body. Third is aerosol mechanism. Recently published article in NEJM and various other researches has shown that the viruses stay in the air for more than 4 hours. So it can spread through aerosol also, and WHO has declared it as an airborne disease also. So we need to wear mask for that. And how can we test it? What are the symptoms? So symptoms are very common, like common cold, cough, runny nose, sneezing, coughing. You can have fever, that can be high grade fever. In severe cases you can develop pneumonia, you can develop respiratory failure, that can land up you on ventilator also. And in some cases patient might develop multi-organ dysfunction syndrome, we call it MODS, and renal failure also. Few youngs are susceptible to virus as similarly as old, but mortality has been seen more in patients who are above 60 years of age and with comorbidities like diabetes, hypertension, heart diseases, and immunocompromised status. So those patients who are diabetic, who are hypertensive, who has immunocompromised status, they need to take much more precaution than normal population, and especially elderly population, because they are more susceptible and they can have severe disease. In Italy, patient with more than 70 years of age, case fatality rate is almost 50%. So that's how it affects the human population. How can we test it? We can take a nasopharyngeal swab, the swab that touches the back of your throat, and we can test it through genetic route. We call it RT-PCR method, and it can tell us whether this strain or particular strain, that Wuhan strain, is present in that secretion or not. How can we prevent it? So prevention is simple. You have to take care of basic hand hygiene mechanism, like frequent hand washing with either soap or water, or with help of alcohol based sanitizers. So sanitizer should be at least 60% alcohol based, or more is, if 70% is there, it is better. Another way is to cover your mouth with face mask. For general public, only simple face mask is necessary, and those healthcare workers who are constantly in touch with this kind of patient and who are into services that who perform such procedures that give rise to aerosol, at that time we need to wear N95 mask. We need to wear proper personal protective equipment while dealing with the patients, and also we should make social distancing. That is very important. We should not go into crowded places. We should avoid handshakes. We should avoid any physical contact. We should be standing at least 1 or 2 meters away from the person that we are talking. That is very essential in preventing this disease. Let's come on to treatment. Treatment wise, there's no proven therapy so far now. No clinical trial has come up with a proven therapy, but few anecdotal reports are saying that chloroquine or hydroxychloroquine might be working in this disease. But let me remind you, there hasn't been any RCTs in this regard. We still don't know how effective is this medicine. Effectiveness that has been reported is only based on few case reports only. So no particular randomized control trial has been conducted in this regard. Vaccine is still in the development phase. We haven't come up with any vaccine yet. The few new diagnostic kits are being available these days, but vaccine hasn't come. So it might take 1 year, whole 1 year to develop a good vaccine against it. Till now, we should rely on the basic hand hygiene, social distancing, and face mask. That is the best bet to prevent it. So I'm a respiratory physician, so I care about respiratory patients. So particular piece of advice for our patients who already got asthma, COPD, interstitial lung disease, they need to take good care of them. They need to be worry about this. There should be some worry about this virus, because any patient who has got underlying structural lung disease or any kind of respiratory disease is more susceptible to get complications, pneumonia, and respiratory distress syndrome due to this virus. So my piece of advice is, if anybody who has got asthma or COPD or ILD, they should practice good hand hygiene, maintain good social distancing, and wear mask always. So in case you have symptoms, you have fever, then consult your nearby pulmonologist or respiratory physician immediately.